Welcome to SkinCast, the podcast where we dive deep into the world of aesthetics. SkinCast is proudly brought to you by Seriderm, a leading distributor of advanced aesthetic solutions. At Seriderm, we're committed to empowering aesthetic professionals with the tools and knowledge they need for a successful practice. Each episode will bring you expert interviews, success stories, and practical guidance to help you maximize your ROI, achieve the best clinical outcomes, and keep you informed about the latest innovations. So sit back, relax, and get ready to unlock your practice with SkinCast.
Hi everyone, and welcome to our latest episode of SkinCast. This is truly exciting today because we are joined by one of the legends all the way from Beverly Hills, Dr. Arash.
Hi, thank you for having me.
Well, I think the last time we met, I was doing an interview with you while I was in Sweden, and I think you were all in LA.
Yeah.
And I was interviewing you over the web. And I can remember thinking, wow, that was a good experience. But
great.
We've got you live today, which is really exciting.
I'm excited to be here. Thank you.
So I guess perhaps for our audience who may not be so familiar with you, perhaps you could give us a little bit about your background. And I guess what got you into the aesthetic industry, and perhaps we could start with that.
Okay, so I'm a facial plastic surgeon in Beverly Hills, and integrated into my practice is heavily a device-based practice with a medical spa. And once I saw the potential of what devices can do, it just expanded, and now I offer 20 plus different devices and combinations of these treatments, and just continue to expand that aspect.
I've been fortunate to follow you. I've seen all the equipment you offer. You have an amazing array of equipment. I guess of all the equipment, I guess we're here today talking about the Laser MD Ultra. What, I guess, excites you about the Laser MD Ultra?
The Laser MD Ultra is kind of like a workhorse device in our office because it's so versatile. It offers something for every patient, all skin types, all year round, from young patients to very old patients, from hair loss to fine lines and wrinkles. So it's very broad, it's very safe, and very effective.
And I guess, so what distinguishes it from other products then? What do you think are some of the unique features that you perhaps like about the product? What makes it different?
So the things that I really like about it are, there's just so many. I mean, I would start with one of them would being that you can do hair loss treatments with it.
Yeah.
I think that's pretty unique.
And are you using that then with like Kerafactor?
Yes. So I love the Keralace treatment, which is to do the Lace MD treatment at a very light and low setting, and then you apply the Kerafactor to the scalp, and then finish it off with the heel light to activate the nanofloral lysosomes, and then you're going to get the perfect treatment.
And I've seen some of your results, and I think it was following some of your results, I was inspired to have a treatment. So, those who've known me for a while and follow me on Instagram will see that I've had a transformation in my hair where it's become thicker, and actually what was exciting is darker.
Yeah.
The hair becomes darker. Is that your experience as well?
Yes, definitely the hair will appear darker, which is very nice because that also gives you more of a sense of volume, the darker the hair is, which is a really nice thing. And it doesn't hurt. It doesn't have any downtime. It's very easy. And it works effectively on men and women. Some of the other treatments for hair are more finicky. This one's more consistent.
Yeah, I found that it was really comfortable treatment. I would say it was pleasant, What about other applications then? What else are you using it for? What sort of treatments are you performing?
Yeah, so that would be the hair. I think for skin, it offers such broad versatility. On its own, you can use it to treat pigmentation and fine lines with 0 to overnight recovery, which is really nice. I love pairing it with other devices, like with Genius, so total skin treatment, because it actually reduces the downtime from your radiofrequency microneedling by eliminating the track marks on the spot and also enhancing the results. So in a week, they're gonna have a glow. They're gonna have high quality skin, which is very satisfying until their RF starts building collagen.
That is one of the problems when you do RF microneedling, you get those track marks. So it's quite exciting that it takes that away.
Yeah, I think that's a big deal. We actually do not offer radiofrequency microneedling as a standalone treatment in our office because you gotta do the laser to reduce the downtime and have that experience that we want.
And do you mix it, Ultra, with other treatments? I have a doctor in plastic surgery in the UK who uses the Ultra post CO2 procedure because it speeds up the healing time. Are you using it in conjunction with other things as well?
Yeah, I think Ultra is kind of the most versatile laser. It combines with everything. It plays very well with everything else that we have to offer. So I do like to layer everything. I particularly became a fan of layering when I visited South Korea, and they love to layer all their devices. So I think Ultra layers perfectly. You can layer it with CO2, with radiofrequency microneedling. You can layer it over soft wave, and so many other treatments, really.
Well, I was with a dermatologist last night, and she was layering it with an IPL. She does IPL first and then Ultra. And so I think it's quite exciting. One of the questions that often comes up for me is there are other people with thulium lasers, similar wavelength, and but much lower power. What would you say the difference is between using a lower wattage system to a higher wattage system? What would be the difference?
Yeah, I have used all the thulium lasers that are on the market, and none of them can match up to the Ultra. The Ultra is the most powerful, but it's also, at the same time, the safest. It's the only one that I've never seen post-inflammatory hyperpigmentation with, and I think that has to do with a mixture of its power and its ability to deliver that energy in a very consistent manner. And it has to do with the intelligence that's built into their systems.
I think from the science point of view, I think that I had to answer this yesterday.
Yeah.
I think a 20-watt system compared to a 12-watt is you end up delivering, if I'm doing, well, we call it in the UK a baby face treatment. I think you call it Ultra Glow in the US. Okay, is that if you have a 20-watt system and a 12-watt, then you're delivering, if you're looking at 5 millijoules, you're delivering a pulse over 250 microseconds compared to way over 400. And I think that probably has something to do with the making laser MD Ultra much safer because it's less risk.
Yeah, I think so, because I frequently will see, for example, Asian patients that come to my practice with hyperpigmentation after they got what they called a laser facial using a thulium laser in another practice. And then ironically, they come to me and I use a thulium laser to get rid of their PIH.
Yeah. I guess then perhaps you could, is it a patient that springs to mind where you think, wow, that was such a good result and you were so happy you got Ultra involved with that patient?
I can think of many patients that I was pretty wowed by their result.
I've been privileged to see some of your photographs of the lecture you're going to be doing tonight, I guess. So I guess you've got quite a few. But anything that stands out to you, think, wow, that was brilliant?
I think it's pretty wow in my melasma patients, because melasma being one of the most difficult things that we have to treat, every treatment for melasma can actually cause worsening of melasma. So it's always a tricky and risky treatment. But with the Ultra, I find that it's very nice. A nice light Ultra treatment combined with the tranexamic acid serum is a very nice treatment that can help effectively reduce the amount of melasma they have. The key is to go slow, go light, and get them there.
And typically, how many treatments would you be offering a client?
I like to do it every 2 weeks when I'm doing the melasma protocol. And I tell them that it's going to range from 2 to 6 sessions. But we're going to go very light with these. And some patients, I will actually alternate it with the Spectra.
Okay. So for those who perhaps not familiar with the Spectra is a nanosecond Q-switch system. Okay. So what would the protocol be for that then? How are you doing that?
So it's Spectra, 2 weeks later, Lace MD, 2 weeks later, Spectra.
Oh, wow. Okay.
Yeah.
And you find that works really well then?
Yes. It's one of my favorite protocols.
Oh, brilliant. Okay. I guess then, is it a key takeaway that you can give our audience? A key message?
About Ultra?
About Ultra, yeah.
I would say my key message is Ultra is a very useful laser. It's a very powerful laser, but it's also a very safe year-round laser. And I can think of something to do on almost anybody where Ultra is going to be of benefit to them. It's so reliable, and I think Seriderm's done such a great job with marketing and creating those named treatments like Babyface and Melabrite.
Yeah. For me, I have time correction. You know, when you get to my age, you need time correction, which I get a bit more aggressive. So I guess Do you use it aggressively as well then?
Yes. I actually love using it aggressively. The more passes you do, the more aggressive the treatment becomes. But even when you use it aggressively, the downtime always is still low and the safety is still high.
Yeah, I was treating as an experiment, just doing 3 layers of 18 millijoules stamping. Then I did 3 passes at 12 millijoules. Then I did another 3 passes at 6 millijoules. And yes, it looked bad for a few hours, but I was fine within a few days again. You know?
Yeah, it's great.
Would you feel safe, because often another question comes up, would you feel safe delegating it to one of your technicians?
Definitely.
Yeah.
I think LaceMD is just such a safe treatment. And if you have guideline parameters for your staff to follow, everything's going to be fine. And to be honest, I most commonly do most of my treatments at 20 watts, which is the max power, even on someone with the darkest skin. I know it's very safe.
Okay, perhaps let's dig a little bit deeper into protocols.
Okay.
So I guess if you got someone, say, coming in, they may be early 20s, pretty much nothing really wrong with them. Maybe they got a slight bit of pigmentation. What would be, how would you treat them?
Yeah, so I love doing the baby face treatment on those young patients. In the US, we call it the Ultra Glow. And I think the concept's great. It's low energy, it's pre-rejuvenation. Some of them refer to it now as collagen banking. And so it's a great way to kind of stimulate the surface of the skin, eliminate light pigmentation, give the skin a nice glassy glow, and easily they're on their way. You compare it with a serum like the VC or the VE vitamin serum, and no downtime with a 5 joule setting.
And how often would you recommend them coming in for that? I like your term of collagen banking. That's a really good term.
Yeah, that's actually very popular right now in the US, is the concept of collagen banking, and everyone's looking for that. And the younger and younger patient demographic is looking for these treatments that are kind of preventing the aging process or putting them ahead of the curve. So collagen banking really works.
And brilliant. And so before we go on to the next patient, perhaps we could expand a little bit more about the serums, because I think that one of the things that I think is unique about the LaserMD Ultra is the fact that it's got 5 specific products that go with the machine, that they mix on the machine, which is quite exciting. We covered earlier about Keralase, okay? So perhaps you can just touch briefly on the other 4 and what you would use them for.
Definitely. That is one of the great things about LaserMD, is that it's the best laser for laser-assisted drug delivery. So when you do a LaceMD, whatever you put on, it's going to actually get in the skin at a lot higher level than with any other pairing. And so these serums are fantastic. They've been specifically developed to pair with LaceMD. As you mentioned, it spins right on the device, and they're all liposomal, which means they actually go in further into the skin. So I like to use the tranexamic acid one the most. That's probably the all-time favorite in my practice, because there's so much issues with pigmentation, and we have such a large range of patients in our practices with a lot of Middle Eastern and darker skin types. So the tranexamic acid is probably the most favorite and used for us.